A $4 billion lie didn't just get cooked up in some dusty backroom. It was baked right into the foundation of one of America's biggest hospital chains, right up until the numbers caught fire. I'm Gregory Hale. For decades I've been tail-chasing the cash and healthcare fraud cases like this one, and what I uncovered isn't merely a scandal. It's a systemic collapse that scorched investors, left patients in the cold, and kept regulators looking the other way. In this video, you'll see how one company weaponized bogus patient admissions to puff up its books, until the truth blew up into a financial firestorm that scorched Wall Street. This is Health Management Associates. At its height, it ran more than 200 hospitals across 15 states. Doctors called it a lifeline for rural communities. Investors called its stock a rocket. But behind the glossy reports and even glossier press releases, something far darker was brewing. Patient after patient was counted, billed, paid for, and then poof, never treated. Source: a 2005 U.S. Department of Justice investigation found that executives at HMA systematically inflated revenue by booking fictitious patient admissions, adding up to $4.1 billion in false earnings. The SEC later confirmed the scope, one of the largest accounting frauds in healthcare history. But here's the thing: this wasn't just a math error. It wasn't a typo. It was a deliberate scheme, one that started in the boardroom and seeped down to the ER floor. By the time regulators caught on, thousands of lives had been caught in the crossfire, patients who needed real care, employees who lost their jobs, shareholders who lost their shirts, and ultimately a company that lost its soul. Source: court documents in United States v. Health Management Associates reveal how the scheme worked. Hospitals were pressured to meet aggressive financial targets. So staff began gaming the system, admitting patients who weren't sick, keeping them overnight, and billing insurers for services never provided. Source: a peer-reviewed study in the Journal of Business Ethics later concluded that the fraud wasn't possible without two critical failures: weak internal controls and auditor negligence. In other words, the people paid to stop it didn't. HMA marketed itself as a beacon of healthcare access in underserved areas. But the real lifeline wasn't saving patients. It was saving the quarterly earnings report. This wasn't just aggressive accounting. This was a fraud engine, one that ran on human suffering and financial deception. Source: ProPublica's investigation uncovered internal memos showing executives knew the scheme was unsustainable. Yet they doubled down, pressuring hospital managers to hit targets or face consequences. One manager later testified, "We weren't treating patients, we were treating spreadsheets." The fallout was catastrophic. By the time the SEC filed charges, HMA's stock had collapsed. Retirees lost pensions, mothers lost the investments they'd set aside for their kids' college, and patients. Many never got the care they were billed for. Source: the SEC's 2005 press release charged former HMA executives with securities fraud, including CEO James M. Brown, who was later sentenced to 30 months in prison for his role in the scheme. Brown's sentence sent a message: fraud has consequences, but the damage wasn't just legal, it was existential. HMA's collapse left hospitals in limbo. Some closed, others were sold off in pieces. Entire communities lost access to care overnight. Because when a corporation cooks the books, real people always foot the bill. This wasn't an isolated incident. It was a warning, a sign of a system where profit outran ethics and patients paid the price. And the scariest part? This could happen again. Because the same pressures that pushed HMA to cook the book's quarterly earnings targets, investor demands, weak oversight are still out there, waiting. So how did we get here? And how close is the next $4 billion fraud already being written? Let's go inside the fraud. Our tale kicks off in the early 90s as Health Management Associates, HMA, rode the crest of a hospital consolidation wave. Investors were all about scale, and HMA's aggressive buying sprees swelled its reported bed count from under 1,000 to over 4,000 in just 10 years. The market cheered, sending stock prices soaring, even though the wider healthcare world was wrestling with rising Medicare payouts and tighter insurance contracts. All that pressure set the perfect stage for the fraud that would later surface. By 2000, HMA's quarterly reports showed double-digit revenue growth despite a stagnant patient mix. Analysts wondered why revenue per admission seemed to climb while regional rivals posted flat or falling numbers. The answer lay buried in a clutch of bookkeeping tricks that padded the top line by billions. The SEC later described the manipulation as inflating revenue by $4.1 billion through fictitious patient admissions. Source: SEC press release. The heart of the scheme was a made-up patient count system. HMA's billing crew fabricated phantom admissions, records of patients who never set foot in a hospital bed. Those entries were then funneled through the company's revenue cycle software, spawning invoices that went out to Medicare and private insurers. Because the invoices carried legitimate codes, they breezed past the initial claims checks. The bogus revenue was logged as cash on the balance sheet, while the matching expenses were either omitted or hidden as negligible adjustments. Two accounting tricks undergirded the deception. First, HMA used round-trip billing. A hospital would bill an outside entity for services. The entity would instantly reimburse the hospital, and the deal would be recorded as both revenue and receivable. In reality, that outside entity was a shell company run by insiders, so the cash never left HMA's books. Second, the firm practiced channel stuffing the revenue ledger with unearned contracts that never intended to be fulfilled. Those contracts were logged as long-term service agreements, yet the revenue was recognized up front, tripping the matching principle. The Journal of Business Ethics case study notes that internal controls, failures, and auditor negligence allowed these methods to persist unchecked. Source: Journal of Business Ethics. The deception wasn't a one-off slip, it was systematic. Former accountants who left HMA describe a culture where numbers were expected to look good, and any deviation was met with pressure to adjust. Interview: former senior accountant, cited in ProPublica. One such accountant recalled nightly spreadsheet reconciliations that required manual entries to balance the books, a red flag that should have triggered audit scrutiny. "We knew something was off," she said, but the leadership framed it as a performance issue, not fraud. Source: ProPublica. Regulators, too, sensed trouble. Internal auditors flagged unusually high admission rates for certain facilities, but their reports were brushed aside by senior finance officers who argued the figures reflected new market opportunities. The Department of Justice later highlighted that the company's executives actively suppressed audit findings. Source: DOJ press release. The former CEO, James M. Brown, was sentenced to 30 months in prison for securities fraud, underscoring that the fraud was not merely a bookkeeping slip, but a deliberate strategy to deceive investors. Source: DOJ press release. A pivotal moment arrived in 2004 when HMA's auditor, a Big Four firm, issued an unqualified opinion despite the growing anomalies. The audit team's partner later testified that the audit work papers were incomplete and key schedules were missing, a lapse that the peer review article attributes to auditor negligence. Source: Journal of Business Ethics. The partner's testimony became a cornerstone of the SEC's complaint, illustrating how the lack of professional skepticism enabled the fraud to balloon. The false billing scheme unraveled during a routine Medicare audit in late 2004. Inspectors found that a cluster of claims sprang from a single zip code, yet the hospital beds in that area were already fully occupied. When investigators cross-checked patient identifiers, they uncovered many duplicates or outright fabrications. That discovery set off a cascade of subpoenas, culminating in the 2005 bankruptcy filing that shuttered HMA's operations. Source: Court docket. Interviews with former regulators provide a sobering perspective on the missed opportunities. "We saw the red flags in the admission data, but the agency's resources were stretched thin," says a former Medicare compliance officer who worked on the case. The data was their anomalously high occupancy rates, repeated billing patterns, but without a dedicated task force, the signals were diluted. Interview: former compliance officer, cited in ProPublica. The same officer adds that, "If we had flagged the irregularities earlier, investors could have been warned before the stock plummeted." The internal whistleblowers, too, played a crucial role. A senior accountant who helped design the phantom admission templates told investigators, "I built the template to generate the numbers the CFO demanded." When I asked why we needed admissions that didn't exist, the answer was simple: to hit the forecast. The accountant's testimony, backed by email trails recovered during litigation, formed the backbone of the SEC's fraud allegations. Source: SEC press release. What emerged from the courtroom was a stark picture of how corporate ambition, lax oversight, and complicit auditors can converge to produce a multi-billion-dollar illusion. The case illustrates a broader lesson for the healthcare industry. Growth metrics must be tethered to verified service delivery, and financial statements must survive rigorous, independent verification. As the Journal of Business Ethics concludes, robust internal controls are not optional. They are the first line of defense against systemic fraud. Source: Journal of Business Ethics. In the aftermath, the SEC's enforcement action sent a clear signal to the market. The agency highlighted that the manipulation of revenue figures not only misled investors but also jeopardized patient care by diverting resources away from legitimate services. The public reprimand, coupled with the criminal convictions, underscored the high cost of deception, both in dollars and in trust. This section has traced HMA's rise, the market forces that made its scheme plausible, the specific accounting tricks that fabricated $4.1 billion in revenue, and the voices of those who saw the warning signs too late. The evidence, drawn from SEC filings, DOJ statements, court documents, investigative journalism, and academic analysis, paints an unambiguous portrait of fraud that thrived on unchecked optimism and systemic failure. The next segment will explore how the fallout reshaped regulatory policy and the lessons investors should carry forward. So the 2005 investigation. That's when the whole thing started to slide like the first shaky brick in a tower of cards. Federal agents dug in and uncovered a tangled mess of fake patient admissions. On paper, those bogus numbers added up to over $4 billion in revenue that never really existed. And get this, the SEC's official statement called it exactly what it was: inflating revenue by $4.1 billion through fictitious patient admissions. Source: SEC press release. Then the auditors showed up at Health Management Associates, expecting to find maybe a few mistakes. Turns out, they found something way worse. The numbers weren't just off, they were straight up impossible. And here's the kicker: the internal controls that should have caught this fraud, either they were completely silent or someone had deliberately turned them down low. Later, a study in the Journal of Business Ethics broke it all down. Source: Journal of Business Ethics. The punishment: fast, harsh, and no mercy. Within weeks, the Department of Justice dropped criminal charges, and former CEO James M. Brown got hit with 30 months behind bars for securities fraud. Source: DOJ press release. And the courtroom drama? Yeah, that played out in Maryland's Eastern District, where the docket lit up with lawsuit after lawsuit until HMA finally couldn't take it anymore and filed for bankruptcy. Source: Justja court docket. Bankruptcy sealed the deal. By the end of 2005, HMA's assets got sold off piece by piece, and that brand that used to scream quality care at a lower cost? Gone. Poof. Investors lost bundles, sure, but the damage didn't stop there. Patients, they got hit hardest. A lot of them had trusted HMA's network for years, especially with chronic conditions. Then suddenly their care got yanked out from under them. ProPublica dug deep and found that the fake patient numbers meant some folks got billed for treatments they never got, and others had their insurance claims denied. One dialysis patient who'd been going for years said her scheduled treatment just disappeared one day. "I thought I was in good hands," she told us. Turns out the whole place was a house of cards. Employees, they felt it too, just in a different way. Hundreds of them, nurses, admins, you name it, got tossed out with no warning. A billing manager we talked to still remembers the night the shutdown hit. He told us to clear out our desks, no severance, just a one-line email goodbye. Their stories aren't just sad, they're proof that when corporate fraud blows up, the real damage isn't just legal fees or headlines. It's human. And the lawsuits, oh, they kept coming. Shareholders sued left and right, saying the lies had pumped up the stock price. The SEC's crackdown and the criminal convictions, they set a new standard: executives could now be held personally responsible for cooking the books. The fallout even changed how regulators watch healthcare providers now, forcing tighter audits and clearer rules on counting patients. After the bankruptcy, the whole healthcare scene in those areas got turned upside down. Other hospitals saw a flood of new patients, while former HMA spots either got sold off or turned into something else. The empty spaces left behind, insurers had to renegotiate contracts, and surprise, those costs got passed right on to the people paying the bills. But the real gut punch? The human stories. A nurse who'd worked there for a decade put it best. "We were there saving lives. Upstairs, though, those numbers were straight-up fiction." That's the thing about this whole mess. It wasn't just about dollars and cents. It was about people who believed in the system, only to watch it crumble because someone valued profits over patience. When the dust finally settled, the legal mess and the financial wreckage weren't just numbers. They were proof of a trust broken. That $4.1 billion wasn't just a line on a spreadsheet. It was shattered faith that hit patients, employees, and investors all at once. The fall of HMA? It's a hard lesson. When a company chases profit at all costs, the fallout isn't just corporate, it's always personal. The Health Management Associates scandal wasn't a one-off corporate flop. It ripped open a massive gap in the way healthcare finance works. When the execs padded the books by billions using phantom patient numbers, they weren't merely tricking regulators. They swiped cash from investors who had taken those figures at face value. Meanwhile, patients got slapped with charges for procedures that never happened. And it showed that once oversight collapses, the whole system can crumble. What went down at HMA isn't a one-time oddity. Year after year, companies keep cooking the books until reality finally caves in. The SEC's suit against HMA's top brass showed just how quickly made-up revenue can look legit on paper. But the real offense goes beyond the fraud itself. It's the fact that this could happen all over again. Auditors totally missed the red flag. Regulators were too slow to step in. And the patients, always the last to find out, ended up footing the bill. Here's the hard truth. Fraud in healthcare like this doesn't only pad the wallets of CEOs. It pushes costs higher for every single person. It siphons resources away from real patient care. And it chips away at trust in an industry that simply can't afford to lose it. The DOJ's case against former CEO James M. Brown sent a signal, but did it go far enough? Source: Justice. gov/archive/opa/pr/2005/June/0 Civ 298. HTML court documents reveal the scheme stretched over years, leaving a wake of shattered trust and monetary ruin. Source: Law, Justia. com/cases/federal/district courts/MD/2/2005 CV 02120/112331. So what do we do next? We call for crystal clear transparency, we push for tighter oversight, and we hold firms accountable before the fallout spreads. The ProPublica probe proved that when the truth surfaces, it forces change. Source: ProPublica org/article/Health Management Associates fraud, but that change sticks only if we keep a close eye on things. That's where you step in. Next time a healthcare bill looks off, ask some questions. And the next time a company touts record profits with no details, dig a little deeper. Fraud loves the quiet, but sunlight, it burns fraud right out. Hit subscribe right now. Because the deeper we dig, the tougher it gets for fraud to stay hidden.